Hey everyone, I'm Shengyi Zhu. In this video, we will discuss the pathophysiology of cystic fibrosis with a particular focus on the respiratory system. We'll also talk about ivacaftor, a crucial drug used in its treatment. CF is a hereditary condition, mainly affects the respiratory system. However, it can affect other organs as well. The CF transmembrane conductance regulator, CFTR protein, is encoded by the CFTR gene, and mutations in this gene cause the condition. There are over 1,700 known gene mutations. This protein located on the surface of epithelial cells act as an ion channel. Due to mutation in the CFTR gene, it produces CFTR proteins that are not able to or inadequately moves sodium and chloride ions across the membrane of epithelial cell. This interruption of ion transport has multiple knock-on effects. On epithelial surfaces, sodium and chloride are essential for controlling the ratio of salt to water. The surface liquid layer of airway epithelial cells become water deficient in absence of appropriate ion transport. As a result, mucus lacks the essential hydration and becomes thick and viscous. The thickened mucus obstructs the airway, making it difficult for mucus clearance. The epithelial cells, cilia, which resembles microscopic fingers, stop working to remove mucus. As a result, mucus accumulates and can block airways completely or partially. Bacteria thrive in the perfect environment that the trapped mucus creates. Chronic infection can result from the proliferation of common bacteria like ones listed here. An inflammatory reaction brought on by recurring infections destroy the walls of airways further. The cycle of mucus production, infection, and inflammation lead to structural alteration in lungs over time. This includes fibrosis and bronchiectasis or dilated airways. As a result, there is a reduction in lung function and airflow, which exacerbates symptoms including breathing difficulties and persistent cough, like we see in Jacob. Now let's talk about ivacaftor, a CFTR modulator used to treat respiratory symptoms of CF. By increasing the activity of CFTR protein, these drugs are specially made to treat the underlying malfunction in CFTR protein. By directly attaching to the CFTR protein, ivacaftor increases the protein capacity to transfer chloride ions across the cell membrane. It targets and enhances the function of CFTR protein that are present on the cell surface but functions less than ideal because of particular mutations. Ivacaftor helps to enhance mucus hydration and promotes better removal from the airways by enhancing the activity of chloride channel. It is used in patients with mutation that cause residual CFTR function. In patients with these mutations, it is used to enhance the lung function, lessens the frequency of pulmonary exacerbation, and enhance overall quality of life. But only about 5% of people with cystic fibrosis have variation of the disease that react to ivacaftor monotherapy. It is more commonly used as a part of triple combination therapy that benefits 90% of CF patients. It is used orally, typically as an oral granule or tablets. In order to maximize absorption, it's crucial to adhere to the recommended dosing schedule and take the prescription with high-fat diet. it is important to regularly check liver function because ivacaftor can result in abnormal liver enzyme levels. Check for any indication of liver failure, such as pain in the abdomen or jaundice. Ivacaftor may interact with other drugs, such as certain antifungals and antibiotics. Reviewing every drug a patient is taking are vital. Inform patient about the significance of following the recommended course of action and the necessity of taking ivacaftor with food. Talk about possible adverse effects as well as symptoms of liver issue that need to be reported. Side effect may be exacerbated by eating foods that contain grapefruit or civil oranges. Ivacaftor treats the faulty CFTR protein, one of the main pathophysiological problems in CF. Ivacaftor works by improving this protein's function, which lowers mucus viscosity and facilitate better clearance from the airways by improving chloride transport. This directly improves lung function and lowers the incidence of infection, which helps patients like Jacob with the respiratory symptoms. Here are my references. Please do not hesitate to reach out for further information or if you have any questions. Thank you for watching.